Definitely, I would say two. No? One is, kasi ang beauty standards dito heavily influenced ng entertainment industry. Kung sino yung mga artista. Of cosmetic surgery. Okay, I would say more or less 2 years because I've gone fellowship training for 2 years and I've started my clinic just this year. The official opening ng clinic was March 30, but I've been practicing since January. So more or less 2 years.
Ano name ng clinic?
It's Dr. Rich Advanced Cosmetic Center. It's located in San Fernando, Pampanga.
And the services you offer?
Okay, so for the services, mostly aesthetic medicine and cosmetic surgery. For aesthetic medicine, the usual injectables, Botox injections, the fillers, for face and body contouring. But then kung yung patient would want a more invasive or mas, kumbaga advanced na treatments, we go surgical. We do liposuction. In fact, kami yung first liposuction center in San Fernando, Pampanga. And also other cosmetic surgery procedures, rhinoplasty, nose job, double eyelid surgery, ano pa ba? Facelifts, tummy tuck, some of the things now we do.
Nag-aral ito? Education.
Okay, so I did my pre-med studies in UP Manila, my medical degree in FEU, and for my fellowship training, I went to the Philippine Academy of Aesthetic Surgery for fellowship training in cosmetic surgery.
Doc, do you believe ba na parang may kakabit pa rin na shame kapag sinabing dito ka? Or everyone is open now? Your thoughts on that?
Okay. In the Philippines, kumbaga, we started with a very conservative yung Philippines. Okay? It's a very Catholic country. Kaya it took us time para yung patients mas maging open to it. Ngayon, the trend that I see, parang mga 70 is mas open, 30% meron pa rin talaga yung mas tago. Yung gusto nila tago yung hindi nila sinishare kung ano pinagawa nila, kung sino yung surgeon nila. But the 70% I would say, mas open. And malaki yung role ng social media doon. Kasi it's on TikTok, very willingly nag-share yung mga tao, sino yung surgeon nila, anong position yung ginagawa nila, which is mas beneficial actually. Kasi ang nangyayari, mas educated ngayon yung mga pasyente before going in sa clinic. So mas naiintindihan nila ano yung complications, ano yung what to expect dun sa surgery. Kaya mas maganda, it's kumbaga kung magpapagawa ka, now is the best time, now and in the coming years, kasi mas maraming pool of information online and mas maraming patient testimonials ka makikita online. Before, anecdotal lang eh. Kunwari, yung tita mo nagpagawa sa doctor na to, so you go to the same doctor. Ngayon, you can compare.
May shame.
Yes, and also may shame, no? Ngayon, you can compare. The doctors willingly namin sinishare yung mga gawa namin as long as may consent ng patient. Kaya, kumbaga, the patients now has a lot of resources para makatulong sa kanila before deciding dun sa procedures na gusto nilang pagawa.
If you were to parang describe the beauty standard ng sa Philippines, ano ba ang beauty standard sa Philippines in this era?
Okay. Ang mga artista natin, mga may lahi. Mostly, di ba? Mga mestizo. So, yun ang beauty standards. So, with the nose, matatangos yung ilong, mapuputi, mga, kumbaga sexy, very slim yung bodies. Another beauty standard, again, in connection with the entertainment industry, sobrang lakas ng K-pop culture here in the Philippines. So that's another beauty standard they look up to, yung sa Korean naman, sa mga Korean idols. That goes both sa lalaki and babae. So again, mga artista, yun ang dalawang beauty standards para mas madali na lang. Mga artista here sa Philippines, no? Mga mestizo-mestiza, saka yung mga K-pop idols naman sa Korea. Males and females, gano'n. Ganun nakikita kong dalawang beauty standards na emerging here sa Philippines.
Anong advantage of going to you in that batang doktor ka di ba? Usually they say Doon tayo sa matanda kasi mas may experience. But you, anong advantage?
Okay. I would say one of the advantage with going with a young doctor is mas iba yung pool of knowledge na meron ng isang young doctor. The reason is, in my training, for example, I had 14 mentors. Lahat yan practicing for more or less 20 years. Each doctor, ganun ang practice. 10 to 20 years each. If mag-rotate ka sa 14 na yon, you can get the best, kumbaga kung ano yung skill set nila, pwede mong i-apply in your practice. So kumbaga I would say, in a nutshell, ang practice ko is a skill set from 14 senior doctors. Yun, kumbaga that's the advantage. You can get, kasi with, kung may mentor ka, hindi naman lahat ng skills ng mentor na yun, you will apply in your practice. Pwede kaming mamili. So I choose kung ano yung gusto kong i-apply from their practice, and then I combine with the other techniques ng other doctors. I would say that would be one of the big advantages of going with a young doctor.
Sir, how about the experience? Anong advantage naman yung...
Okay, definitely doing more surgeries will will hone your skill, in any type of surgery. Okay, so that's actually one factor. That's why yung mga patients, they would go to a mas veteran na doctor. Pero hindi mo madi-discount yung the fact na we went through the same na rigorous training din. During my fellowship training, I would say I've seen hundreds of cases, both rhinoplasty, liposuction. You assist in these surgeries. So, kumbaga, I'm new in the private practice, but I've handled multiple cases na rin. So you cannot discount that fact, no? So yeah, I would say, yes, may advantage. The more you do the surgeries, the more you hone your skill. Pero it doesn't mean na hindi magaling yung mga young surgeons.
Okay.
Where in fact, I'm sure ang sikat ngayon would be the facelift of Kris Jenner. And the doctor of Kris Jenner is actually not even the oldest, surgeon in New York. Actually, medyo bata-bata
When he
yung
could
surgeon niya. And with very good results. With very good results. So yan, I think that's yun yung answer ko for that question.
How competitive the rate of your clinic compared to other skincare and aesthetic centers?
Okay. And what your advantage with going? Okay. Actually, we are a clinic complex. There are two specialties in one clinic. Dr. Rich Advanced Cosmetic Center handles the cosmetic surgery side of the things and mga invasive na aesthetic medicine, so the injectables, ganyan. At the same time, there's another clinic brand in the place, Skinotech, which is for dermatology. So Skinotech is Skin Innovation and Technology, handled by my mom, who's a dermatologist, Dr. Pinky Albano. So you have two expertise in the field when you go to the clinic. Kasi usually the patients naman who would want enhancements, usually dalawa talaga gusto niya. The skin, enhancing the skin, and also face and body contouring. And what's good about the clinic complex, they can get both expertise in one place. Hindi mo na kailangan lumipat pa sa ibang clinic.
Yeah.
We're well equipped for both specialties.
Dahil sa Pampanga nga ba, may package ka ba na may accommodation na din? At medical tourism, may ganun ka ba?
Actually, we have, no? We partner with the hotel kung yung patient willing to go to Pampanga have the surgery done. We have patients from Visayas, for example, and we arrange it for them. Para pagdating nila doon, kapag wala na silang isip, punta na sila doon, they have accommodation nearby the clinic.
You're near Clark Airport ba?
No, from Clark, we're about 30 to 40 minutes
Pwede.
drive from Clark.
Kesa
Airport.
naman from Maynila.
Yes.
Sorry, I interrupted you. Go ahead.
Yes, no, it's okay. So yun, we arrange accommodation for them. Mas gusto ko actually yun kung the patient is galing sa malayo na magsistay sila kahit 1 to 2 weeks lang. Para during the recovery period, may problema man. Sana wala. Walang magka-problema. Kaya-kayang i-manage kasi malapit lang kami dun sa kung saan siya nagsistay during his or her recovery.
Showbiz angle lang ako, Doc.
No.
Would you encourage public figures or celebrities to admit or to really say kung nagpagawa sila? Kasi yung mga followers nila, baka public figure ka, sabi mo, this is all natural, I just did it, papapayat lang. Tapos nagpapakamatay yung followers mo na natural lang, trying to achieve something that's not achievable by natural means. What are your thoughts on that?
Okay, that's I would say a complicated
Yeah.
question.
Kasi,
Pero, okay. May personal take na lang.
Your personal take.
May personal take ko din. First, it's always a personal choice. Doing a surgical procedure or if you're willing to admit it.
Right.
If you are a private person. Pero if you're in a kumbaga public, you're in the public eye, and you have followers, meron kang fans that look up to you, parang, kumbaga, hindi naman sa utang na loob, pero it's your duty not to lie to your
Duty
fans.
not to lie.
Kasi it's the foundation of being a public figure is trust eh. Kaya you have certain followers kasi they trust you. What you endorse, what you say, kung sinabi mong ito yung magandang product versus this product, they trust you, kaya they follow you. Mapunta ka man sa movies, commercial, they go with you. So merong trust. That's the very foundation of it all, ng relationship na yun. So, kung sisirain mo yung trust by not admitting na ito yung pinagawa mo, then I think that is detrimental for your kumbaga, public image.
Right.
For your public image. Kasi you owe it to them. You owe it to them to, kung pinili mo maging public figure, I guess, dapat na-consider mo na yun na you should be as transparent as you can when it comes to your public image. Kasi the way I see it, for example, merong 6-year-old girl who looks up to, let's say, very beautiful actress.
Celebrity A.
Yes, na let's say may enhancement siya, pero hindi niya inaamin. Ano naman magiging mental,
Diba?
Kapag repercussions for a 6-year-old girl na trying to navigate the world as a woman. A very unrealistic beauty standards, tas it's both physically and mentally, I would say, detrimental doon sa growing little girl. So, kung public figure ka, I guess, you should consider yung factors na yun.
Ano yung data niya na sa male, may growth ba sa male na nagpapagawa? Male?
Yes. Marami din.
Kasi before, sinasabi pang babae.
Pamaba, yes. I would say majority females pa rin. Pero may growing trend na maraming napapagawa na males. The social media is really a big factor dito. Kasi even on TikTok, the males are willingly sharing kung saan sila nagpapagawa. Apart from that, not even surgical even yung self-care lang na facials, that's very feminine, I would say, in the past. Pero ngayon, kumbaga, the value of self-care,
It's for everyone.
yes, mas binibigyan siya ng value ngayon. Cutting across all genders. Male, female, self-care is really, kumbaga, one of the great investments na pwede mo ibigay sa sarili mo. Kaya, yung that statement, nag-resonate siya ngayon, both males and females. Kaya even the clinics have male ambassadors ngayon. Kasi, kumbaga, it's an emerging market.
Does it mean, Doc, na maraming mga insecure?
Okay. Very good question.
Does it always stem from insecurity?
Okay.
Because even yung heart evangelista revealed sa vlog niya na nagpagawa siya kasi insecure siya. And until now, parang she has this obligation to tell the public na hindi to gawa, ito gawa.
I would say yes. Definitely, it will stem out of a certain sense of insecurity. Kasi hindi ka, kumbaga, you will not spend that much money and go through that recovery and operation kung it's something na mababaw lang sa'yo. No, definitely, if it's an insecurity na talagang naka-affect sa life mo, no, yun talaga one of the deciding factors, kumbaga, of the patients of doing the procedure. Yeah, and then there's nothing wrong with that. No, lahat tayo may insecurities. Even the most beautiful people in the world have insecurities. And if you're capable of, kumbaga, allaying that insecurity, no, why not? Diba? You only live once in this world. Might as well live it the way you wanted it.
Talk about the trends. Ano po yung mga trends sa beauty industry?
Okay. Hindi talaga nawawalan ng rhinoplasty patients in the Philippines kasi the typical Filipino nose,
Flat.
di ba, walang braid, mostly
Walang
walang
braid.
braid,
Malaking
medyo wide
nostrils.
yung ala, yung the nostrils, gano'n. So, trending talaga pag sa rhinoplasty. The advancements in rhinoplasty, the different techniques na bago, yon, it's really, kumbaga never mawawala sa uso yung advancements in rhinoplasty. Pero in recently, because of Hollywood, the influence of Hollywood with doing the facelifts, yan sina, di ba, allegedly, like, sina Lindsay Lohan, sina Kris Jenner doing the facelifts. So
Demi Moore.
Yes, it's Demi Moore. One of the trending ngayon is doing facelifts at an earlier age. Before, mga 60s, 70s, you do the facelift. Ngayon, mga 40s. No? Kasi with any other surgery naman, healing is better when you're younger. So, ngayon, I guess that's the emerging trend ngayon. No? Doing facelifts at a relatively younger age than before.
Pero yung salmon na patient.
Okay.
Have
And
you
that's
heard of that?
yes. Dun sa non-surgical naman would be it's a salmon DNA. No?
Galing talaga siya sa fish.
Yes, it came from salmon sperm actually. Okay, it's think of it as stem cells, no, from salmon sperm. It emerged from Korea. Non-surgical siya, you inject it to the whole face, improves the texture of the skin, lumiliit yung pores. Yun. That's a non-surgical side of the industry. Yun yung emerging trend. The injecting salmon DNA on the face.
Is it safe?
Yes, it's
It is.
safe. Syempre, with any other injectables, meron at merong mga kumbaga side effects. For example, kumbaga yung magpapasa, no? Probably there can be allergic reaction. Pero I would say very rare. Very rare. I do it also in the clinic.
Ah, you do?
Yes, so far all patients are very satisfied with the results. Actually, nagpapa-inject sila just because nakikita nila yung video ng Koreans doing it abroad and asking sa clinic, Doc, meron ba kayong ganito din? So, yeah.
Yung vampire facial.
Okay.
Yung galing sa sarili mong dugo.
Yes, it's a platelet-rich plasma facial naman.
You do that also.
Yes, we do that also. It's in one umbrella. Platelet-rich plasma, PRP, the vampire facial, and also salmon facial. It's in just one umbrella lang yung mga yan eh. They give the same, almost the same effects, kumbaga. Pero, yun nga, in this industry, there's always something new. And between the two, yun yung mas bago. Yung sa salmon DNA.
And the vampire. You do the vampire
Yes,
thing then?
yes. That's mas matagal na yon na ginagawa, the vampire facial. Mas matagal na siya. Mas bago yung sa salmon DNA. But effects-wise, same ang target nila. They want to improve the skin texture, they want to improve yung sa pores.
One of the most affordable services is Botox. Ano ang and easily makikita mo yung resulta, no?
Yes.
At walang downtime. Anong pinakabatang edad na pwede? At saka sa experience nyo, ano yung mga edad na pumupunta sa inyo for that?
Okay. Before, mga early 2000s, during the time of my mom, nung nagpa-practice siya as their mga ano talaga, 40s, 50s ang nagpapabotox. And during that time, the way to do Botox, very frozen. Alam mong nagpa-botox yung patient.
Hindi magalaw yung
Yes.
something.
I would say the mas modern way is one, the way na ginagawa ng botox injections ngayon, you would want na may expression yung face, pero less yung lines. And second, the age group also na nagpapagawa. Nag-emerge kasi yung term na preventive botox, which
Baby
is
botox.
yes,
Yung
which is
ginagawa.
which is doing it at a younger age.
Oh, diba?
Para instead of treating pag nandyan na yung lines, i-prevent mo na lang. Yan. I would say
And that's
yun.
okay.
Yes, that's okay. That's okay. As long as the patient is willing to do it and can afford it.
But I mean,
why
health,
not?
safety-wise, it's
Yes,
okay.
it's safe.
Wala siyang pag tumanda kami, alam mo, may balik.
Wala. With Botox, no? Wala.
Pero given a chance, paano mo gusto makilala ang Dr. Rich Advanced Aesthetics? In what expertise?
Okay. Of course, the big picture is I want it to be a household name in the aesthetic medicine and cosmetic surgery industry. Kumbaga, whatever the patient wants to have done, pag pinagawa niya at Dr. Rich Advanced Cosmetic Center, he or she is assured that he or she will get the best. Personally lang, in my practice, I wanted to do liposuction. It's just a personal take. It's a fulfilling procedure for me to do. Kasi yung mga nagpapalipo na yan, most often than not, nag-try na yun mag-diet, nag-try na yun mag-exercise, at pupunta sila saya frustrated. Yeah, so, coming out of the clinic, makikita mo sila na throughout the years, silang struggling with their weight, with their body image, makikita mo sila they're very happy with the results. That really makes me very fulfilled.
You used the word transformative kanina. It's a transformative.
Yes, it's really a transformative procedure for this patients. Really liposuction.
Ano yung fulfillment na nakukuha doing that?
Okay. Of course, as a cosmetic surgeon, syempre the visual of it, pag nakita mong you really did something to drastically, kumbaga, meet yung goals ng patient. Pag nakita kong nagawa ko yun, that's fulfilling. Another thing, pag nakita mong your patient is very happy, babalik siya sa'yo during your follow-up and tell you, Doc, buti na-meet kita, or buti I went with you, or kahit yung ganun ba, that's very fulfilling sa akin. Kasi, first and foremost, doctors pa rin ang cosmetic surgeon. So you would want your patients to, kumbaga, go out of your clinic na
Magre-recommenda pa.
na satisfy siya. Kumbaga kung ano yung pumunta siya sa clinic mo with a certain problem, as a doctor you have to address it. So pag na-address ko yun, that really makes me fulfilled.
You use the word problem, so it's not always about vanity. Meron talaga mga procedures na may medical,
Yes.
meron
Yes, meron mga procedures na kumbaga meron medical benefit.
may medical benefits.
One example would be doing upper blepharoplasty, for example. When you're aging, yung skin sa upper eyelid, bumabagsak talaga siya. No? At a certain point, ang feeling ng patients is, alam mo, yung parang kabayo na nakaganon. Ganun yung visual, nila, nakikita nila when they're driving. Then may medical benefit siya. So not just aesthetic, meron siyang
not just aesthetic.
yes, medical benefit.
Thank you, Doc.
Alright.
Thank you.
Thank you.
Thank you.
Ganun pa. Okay.
How did it go? Okay ba?
Yeah, okay.